नमस्ते बिटिया, हमेशा खुश रहो बिटिया। A very good morning to you all. Myself, JV'n Dr. Ravi Jain, Assistant Professor, Department of Practice of Medicine, in Faculty of Homeopathic Science at JAYOTI VIDYAPEETH Women's University, Jain. In today's lecture, we are going to discuss about the clinical examination of male genitalia. This is the part of urogenital examination, and in today's lecture, we are going to discuss how to examine the male genitalia. When a patient with some disease, a male patient with some disease pertaining to the genitalia is coming to us. So let's start with the examination of male genitalia. There are the anatomy, the normal anatomy of the male genitalia you have already discussed or learned in your first year. The anatomy and physiology is already known to you. So I need not to repeat the normal anatomy and physiology, but rather I will directly start from how to do the examination of the male genitalia. So there are four aspects in doing the examination of any system, that is inspection, palpation, percussion, and auscultation. So in male genitalia, we are mostly doing the inspection and palpation. There will not be any kind of percussion or auscultation. So let's start with the inspection. First of all, the penis. First of all, during the inspection, note the size of the penis, the presence or absence of the prepuce, and the position of external urethral meatus. Examine the penile shaft for any kind of presence of warts or ulcers, burrows, and any kind of excoriated papules of scabies and rashes. So we have to check for the size, the presence or absence of prepuce, the position of external urethral meatus, the examining of the penile shaft for warts or presence of any kind of ulcers, burrows, and excoriated papules of scabies and rashes, especially seen in case of syphilis or sexually transmitted diseases. Next is the palpation. While doing the palpation, you have to palpate the penis between your thumb and your first two fingers for any kind of tenderness or induration, that is pain or pressure. Palpation of the shaft may be omitted in a young asymptomatic male patient. So if you have any kind of trouble, then only palpation is needed, otherwise it can be omitted. Then you have to check for the scrotum and its contents. Again, the two methods, inspection and palpation of the scrotum and the contents. Look at the scrotal skin for any kind of redness, swelling, or ulcers. You have to check the skin for any kind of redness or swelling or ulcers. Lift up the scrotum so that you can see its posterior surface. So you have to inspect the palpation. You have to palpate the testes, note the shape, size, and consistency, and tenderness. So you have to check for the size of the testes, the shape, the consistency, and any kind of tenderness. Place the right hand below the scrotum and palpate both the testes separately. So you have to check both the testes separately. Then you have to check for the epididymis and the spermatic cord. Palpate the epididymis at the upper pole of the testes posteriorly. The head is felt between the left thumb anteriorly and index and middle fingers posteriorly. So this is the way of feeling the epididymis and the spermatic cord. The soft and nodular structure of about 1 centimeter in length. Then we perform the trans-illumination test by putting, in dark, one side we are putting a torch and the other side we are looking for any kind of swelling in the scrotum other than the testicles can be evaluated by trans-illumination. Trans-illumination is basically illuminating the light and dark, putting a torch on the testes and then looking in the dark for any kind of presence of swelling or anything else. I will again repeat these examinations. First of all, for the examination of male genitalia, you have to do the inspection and palpation. These two things are clear. First of all, we are looking for the penis. We are doing the inspection for the presence of absence of prepuce. Any kind of for the checking the position of the external urethral meatus, for checking the penile shaft for warts, ulcers, and burrows, or any kind of excoriations. When we are doing the palpation, putting the penis between the thumb and first two fingers for any kind of tenderness and induration. Palpation of the shaft may be omitted in case of asymptomatic patient. Then you are checking the scrotum and its contents by doing the inspection for the skin for any kind of redness, swelling, or also lifting the scrotum so that you can see the posterior surface. Then the palpation of the testes for its shape, size, consistency, and tenderness by placing the right hand below the scrotum and palpating both the testes separately. Then we are doing the palpation for the epididymis and the spermatic cord at the upper pole of the testes posteriorly, and the head is felt between the left thumb and anteriorly and the index and the middle finger posteriorly. It is usually soft and nodular structure for about 1 centimeter in length. Next is the trans elimination test by looking through a torch into the dark in the scrotum for any kind of abnormality or swelling. So this was all about the examination of the male genitalia, manual examination of the male genitalia. In the next lecture, we are going to discuss the manual examination of the female genitalia. So this was all for today. This session was powered by digital version 2.0, JAYOTI VIDYAPEETH-FHS University. I hope you are satisfied with my digital session. If you have any query, please mention in the comment box and I'll try to resolve. So this was all for today. Thank you very much. We will be meeting in the next lecture tomorrow. Thank you.